fear. So joining us today is Dr. Andrew Carroll, who's on the board of directors for the American Academy of Family Physicians. Hi, Dr. Carroll. Good to see you again.
Great to see you again, Trent.
Here's our first question from Jeremy on Facebook. Is it possible for someone to get the virus and never get sick?
Yeah, it absolutely is possible. I've had already one patient who had a bunch of friends. They had gone on a trip, and he came back, and his friends were all positive, so we tested him, and he was positive as well. 0 symptoms, no fever, no body aches, no cough, just that risk of exposure. So, yes, you can get the virus and not have any symptoms, which is why this stay-at-home order from Governor Ducey is so important. If we can do this for this month, we really can stop this thing, just flatten that curve.
All right, one viewer texted us this question. She said, I have loved ones with diabetes. Should I be worried about insulin shortages?
So right now, we have not heard anything about insulin shortages from any of the major companies like Eli Lilly. They all have these pretty wide production manufacturing facilities in many, many different countries. None of the chemicals that they use for their insulin come from China, so we're not concerned about the supply chain there. So they've reassured that they've got a pretty good supply of insulin, and we really shouldn't be worrying about needing to stock up or hoard up on any of those medications.
All right, good to know. Another viewer asked this. Many medical tests and non-essential procedures have been postponed. Are doctors worried about an overflow of patients suffering other medical issues?
Not at this time, because we're exiting the winter, which is when we see a lot of people with illnesses like flu and other things. Yeah, we're delaying some of the elective procedures, elective surgeries. We're trying to keep those folks out of the hospital. Plus, when you use them for surgery, it's a ventilator that we could use in the ICU. So that's the reason why we're delaying a lot of these things. But us primary care physicians, most of us are still seeing their patients for their chronic issues, like their diabetes or blood pressure. We're still seeing them when they're sick, rashes and other things. So if you have a chronic health issue or even an acute health issue which needs addressing, make sure you call your primary care physician, your family physician for that problem.
All right, Dr. Carroll, and I'm just wondering, just from a holistic point of view of just trying to prevent being sick in the first place, whether you contract COVID, more specifically if you should, but is there anything that we could just be doing in terms of our diet, what we should be stocking up on, certain fruits, vegetables, what have you, just to kind of keep a healthy immune system?
So the rules there have not changed. We want you to eat healthy diets, fresh fruits and vegetables if you can, right? There's some difficulty with that at the grocery stores, but if you can, get fresh fruits and vegetables. Probably more important, exercise. If, the stay-at-home order has not excluded us from going outside and exercising with our families, staying away from others if you're at a park, but going around for a good walk out in our beautiful sunshine, it's a good time to get that habit going so that you maintain that physicality, and that helps to boost the immune system probably more than anything else.
Okay, good to know. We will try our best. Dr. Carroll, thank you so much for your time and insight.
Thanks so much. Take care.
Thank you. You too. Stay up to date on all the latest news by downloading the 12 News app for the facts on coronavirus, and email us your questions on Facebook or text Team 12 at 602-444-1212. From medical